Hello Internet, I'm Jackie Fox, and previously on this channel I've gotten into ideas like Bernie Sanders and Medicare for All, and pitted those ideas against Joe Biden and the Affordable Care Act. But I've never really gone in depth about just what makes the Affordable Care Act so inherently bad.
Our current healthcare system is, well, how would you put this? It's in the danger zone.
Now this whole subject is striking really close to home for me today because over the last couple days I have developed a pair of ear infections.
Oh, this is great. This is just great for my ears.
This is what I was talking about with the whole tinnitus thing.
My local pharmacies do not have any of the treatments that I would normally want to use for this because people panic bought them. And I can't really go to a hospital right now, even if I thought I could afford to do so because of the current pandemic. So I'm pretty fucked. But even if we weren't in the middle of a pandemic, those over-the-counter treatments would really be all that I would be able to afford to do for myself, and I would have to hope for the best, because I have never in my life been able to afford health insurance. And even if I was able to afford it, I wouldn't have been able to afford to use it. And that is inherently the problem here. A lot of the proponents of the Affordable Care Act like to remind you that now 20 million Americans have health insurance that previously didn't. And they act as though this simple fact outweighs any negatives that the Affordable Care Act might have had on our healthcare system in this country. But at the same time, there are some very good counterpoints as for why the Affordable Care Act is a negative change to the status quo. As a person who worked in the insurance industry and the health insurance industry, both before and after the Affordable Care Act, I understand some of those complaints a little bit more than most. First of all, the way that premiums and in healthcare, copays and deductibles are calculated is they're set at whatever level of money has to be paid to first and foremost make sure that the insurance industry gets paid hand over fist, but also to be sure that there's enough money to cover people who would actually use the system that they're paying into. While it was a great idea to remove pre-existing conditions, as well as some of the other changes the Affordable Care Act brought us, it also brought us higher copays and deductibles. And those higher copays and deductibles make the health insurance that 20 million more of us are now paying into less usable for possibly more than even 20 million people. Which means that quite a few of us are paying good money for a service that we will never be able to use. In addition to that, while the cost for the consumer may be similar to what it was before, while being able to include more people than before, if a net total of less people are actually able to utilize their healthcare insurance, that just means that more people are paying for a service that they cannot use. It means that, in other words, more Americans are being ripped off by health insurance industries now as a result of the Affordable Care Act than before. And before Bernie Sanders became a mainstream voice in the Democratic Party, it was really only disingenuous Republicans who were making this argument. And they made it in some fundamentally bad ways.
Here's the problems I have with the Affordable Health Care Act. Number one, there's a provision in there that anyone over the age of 74 has to go before what is effectively a death panel. Yes, they do. Yes, they do. It's in there, folks.
While they talked about death panels, they didn't mention the fact that healthcare in our country, both before and after, is being rationed to only those who can afford it. This leaves the poor to die and the middle class to survive, but with massive medical debt that forces them into bankruptcy. And it seems like to me the only winner here is the insurance companies, who are now able to leech money from even more people than before, but also quite massively from the federal government as well through subsidy. In the midst of this crisis, we're also seeing the fundamental problems of tying healthcare to having an employer. As of right now, there are at least 10 million people who have been laid off work since this crisis started. And this is with unemployment websites crashing at a spectacular rate, and lines running out of physical offices, often with disregard for the safety of the people in those lines. People are going home just so that they don't catch the coronavirus standing in line for unemployment, waiting for the lines to go down. So, in actuality, there could be many more people unemployed now. unemployed in a healthcare crisis where their only healthcare was given to them by their employer. And this is a massive problem. But it also highlights another benefit of Medicare for All, in that it would be incredibly beneficial not only to small businesses but to large businesses as well, that they would no longer be on the hook for their employees' healthcare. This would save not only the average American taxpayer, but the average American business a lot of money on healthcare costs while providing better quality healthcare to everyone.
They are paying $12,000 a year, 20% of the income for healthcare. Their employer is paying even more. Comprehensive healthcare under my Medicare for All plan, by the way, that includes dental care, hearing aids, eyeglasses, and home healthcare. $1,200 a year is a pretty good deal, it seems to me. That doesn't cover it all. That does not cover it all.
Not nearly.
What we impose is a 7.5% payroll tax on employers. That will save employers money.
See, one of the reasons that this is able to work is something that I learned when I was studying for my health insurance exam back before the Affordable Care Act. See, back then when we had pre-existing conditions, one of the well-known ways of getting around a pre-existing condition was to sign up for a group health plan, typically offered by employers. The way these plans worked is they distributed an individual's risk among the group of employees, or the group in general, that was being insured. And as long as most of that group got insurance, the idea was that your individual risk would be mitigated by all of those people paying in. And I can think of no better way to do this on a grand scale than to have universal public health care for the American people. And if we had elected Bernie Sanders instead of trying to run Hillary Clinton in the primary, and he had gotten us Medicare for All back in 2016, phasing it in over 4 years, we would now not be in this situation. And I think that it's kind of disingenuous to try to argue otherwise. I mentioned all of this in a script for a video that will soon be coming out on this channel, and then I asked my friends to look it over, and one of them came forward to me and said, I used to work in an Affordable Care Act call center. And she wanted to share her experiences in relation to that. So with no further ado, let's get into it. I assume everyone who's watching this video knows that I'm Jackie Fox. Who are you? It's probably their first time seeing you.
Well, I'm Faye Fahrenheit, and I worked for the Affordable Care Act call center from 2016 when Obama was in office for like 2.5 years until I got a suicidal caller. And walked out of the building during the Trump administration. And I went back briefly for a short period of time again, and ended up getting fired for getting the flu because they don't cover the flu as an illness that's excused. So I got sick for 2 weeks, and they fired me from the Medicare department for that. But yeah, no, my current roommate, who's a really good guy, I'm not going to mention his name because they'll fire you if you talk shit about them. He intends to get rehired there at some point. He walked out of the building because they're not offering any COVID-19 protection for people, even though we have confirmed cases at our center.
Yeah, the way that they mishandle your healthcare is incredibly ironic.
It's pretty bad. There's no sick time. Like they have a crazy turnover. I'm sorry, what?
I said that's the nice way of putting it, is ironic.
No, they have a really, really high turnover rate at the Affordable Call Center, the Affordable Care Act call center. It's technically a government contractor, and the government contractor changes every 5 years. And so they've been a part of General Dynamics. They've been a part of, a whole bunch of different places. Right now, they're with Maximus Federal.
Okay.
And so they're a government contractor, and the government sets up the guidelines for the program. Your job as a call center rep is to get people access to healthcare that they need. And there are a couple different avenues for that. You can go with financial aid, like Medicaid, or like local programs, community health centers. You can sell Affordable Care Act plans, which are dog shit and cost a lot of money. Or you can sign people up for Medicare, which is much better, but not enough. Medicare doesn't cover a whole bunch of shit. People who say Medicare for All is a good idea without stipulating specifically that Medicare needs to be expanded don't know enough about Medicare.
Yeah.
It doesn't cover dentures, for example. So, old people need dentures, but it doesn't cover dentures.
Yeah, my mom is actually dealing with that right now. And
they don't cover a bunch of shit. It's insane. When I was in Medicare, I was talking to this guy who was homeless and he had AIDS. And he basically got AIDS in the 80s during the AIDS epidemic. He was a gay man. And he was calling me from a state with expanded Medicaid, California, right? Very good state to be sick in because they have Medi-Cal, they'll cover a whole bunch of shit, and also Medicare. Well, even though he was in California, because of the way Medicare hospital days work, you're only allowed to get a certain number of days in a row before you run out of days, and then you have to wait 3 months for those days to replenish. So the situation he was in is that he would spend 3 months in an AIDS treatment facility in a hospital. So that's 90 days. And then his 90 days would be up. And then he would be kicked out of the hospital. And he would live for 3 months or so in a park nearby the hospital, just homeless, until his days replenished. And then he could go back to the AIDS treatment center.
Wow, that's terrible.
Oh yeah, no, and that's Medicare. This guy had Medicare and Medicaid, and it wasn't enough. It was completely ridiculous. And calls like that weren't even like the worst calls I took.
What were the worst calls?
Man, I have a lot of funny calls I could tell you about, but because we have people call in the middle of the night to the Medicare line who frankly need legitimate mental help and don't have access to it, and so they just call the Medicare line and basically ramble about like their paranoid delusions. Like we had a lady call in every night and she would tell us that like people in various supermarkets in the Las Vegas area were spying on her, and she would want us to take like detailed notes about it. We had a lot of people call in and ask for like weird sexual favors over the phone, and so it was not a fun experience even when you didn't get like terrible calls, because we had like a guy who would call in and he had been blocked on 8 or 9 different numbers from the call center, but he kept finding new ways to call us. And when he would call, a profile would pop up on the computer that said, "Do not talk to him. He will sexually harass you. Here's what you say." And it would have like a script that you would read to him, telling him not to call him. But no, he would call and he would ask like healthcare related questions. He'd be like, "Okay, yeah, so how much does this Medicare plan cost?" And then he would like, because we couldn't hang up if they were asking healthcare related questions. So his strategy was to like ask healthcare related questions and then ask inappropriate questions in between. So he would ask like these random ass healthcare questions, and then he would be like, "So what kind of shoes are you wearing?" Yeah, no, we had a lot of weird calls. We had one person got tired of being put on holds during tax season for the Affordable Care Act line, and I took this call, and it was really funny. But I guess they were tired of being put on hold because when I answered the phone and I said, "Thank you for calling Marketplace, blah, 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 how can I help you?" They were having sex with their spouse on the phone.
What?
Yeah, no, we had a guy call in and pretend to be the Ninja Turtles and try to order a pizza. We had people call in and pretend to be Shaggy and Scooby-Doo. A lot of people prank call the Medicare line, actually, in the ACA. I don't know why, because the whole time is insane.
I wonder if that's just like maybe a general call center thing. Like, I know some people work for call centers. I should probably ask around.
Oh, people are really inappropriate because you have to talk to them and they are going to take advantage of that.
I've had customer service related jobs like that before, but none like ones where they had to show up and do that to you, so they're a little bit less out there than what you're describing. But yeah.
Yeah, no, and people are very easily offended. Like I had to ask someone on the application if they had ever been incarcerated because it's a required question. And they got mad at me and they're like, "Are you saying I'm a fucking criminal? Is that what you're saying? You think I'm a thief or a murderer?" And they like got mad and hung up.
I guess that was a yes. Sounds
I
like
don't know.
yes
Some people call in and it's like, you know what this is. This is a government line. And then I'll be like, "Can I have your social security number?" And they'll be like, "How dare you ask me for that?" And it's like, "Okay, well, you can do it online then." And then they'll get angry because I need it.
I guess that technically puts you in like a sales situation.
Not exactly. No. We did not get commission. It was not a sales position. Our job was to assist them to the best extent possible. We got $12.95 an hour.
So you were more like tech support.
Yeah. We were healthcare support. We were not salesmen. Like an agent or a broker for healthcare is a salesman. They're selling you a healthcare plan. I am not allowed, because I'm a government contractor, to have an opinion on what kind of healthcare plan officially you should buy. And so when people would ask, what's the best plan? I would have to be like, well, this plan has this benefits and this plan has these benefits, and that's all you can say. And if you're trying to steer them towards basically the better choice, you would have to be like, well, this plan has these benefits, and then say it slowly, but you couldn't actually directly tell them what your opinion was, or you get fired. So it was not a sales position at all, which makes it worse because honestly, $12.95 an hour is not enough to deal with some of the crisis calls we had to take. Because what made me quit was we had a lady call in and threaten to kill herself on the phone because she couldn't get access to her medication. She lived in a red state. She was an older woman, wasn't old enough to qualify for Medicare because her state didn't expand Medicaid. She couldn't get Medicaid. Her only option was an ACA.
Hey, that's my situation.
Yeah, her only option was an ACA plan with a tax credit. And because she made, get this, too little money, she didn't qualify for a tax credit. She made $60 short of the requirement. And so I told her, I'm sorry, unless you can make an extra $60 a year, you can't get this tax credit. She starts crying. She starts saying, I can't get my medication. And if I can't have my medication, I'm going to die. And if I'm going to die, I want to go out on my own terms. I'm not going to let someone else kill me. I'm going to kill myself. I'm going to go out the way I want. She started saying stuff like that to me. This was like a 45-minute long call, ended with me in tears. And we had like a little red flag that was laminated that you could wave on the call center floor when you had a crisis call. And so I waved it, suicidal, and that my job was to deal with stressed people, and so I should just deal with it, basically bootstraps. And so I walked out. Yeah. I do know that lady got a call back because I complained to a manager. So the manager called her and made sure she didn't kill herself a week later. But like our ability to help people is limited. Like I remember, this was a friend who took this call who previously worked in the center, and it was awful. The call was a mom was on the phone. Her child had some kind of terminal illness. He was an adult son, and he was in the other room, and she was like pounding on the door, talking to us because she couldn't reach anybody else. People call us when they need to get access to healthcare, and oftentimes it's a life or death situation. And so he couldn't get access to his medication. He's terminally ill without the medication. He's going to die. And she's pounding on the door trying to get him to talk to us because he's suicidal. And my friend heard a gunshot. He actually killed himself on the line. And then we heard the mom, he actually heard the mom go in and discover that her kid had died. And then he had to stay on the line for the entire time while the mom was crying because he had to wait for the police to show up. $12.95 an hour.
Yeah,
Yeah.
I'm just trying to imagine like how you, if you have a job that puts people in that situation, like what do you do when that happens to make it right with the person who had to experience that? Like, I mean,
you can't. I've always felt. I feel like what we're experiencing right now with the COVID pandemic is similar to what I experienced at this call center in one particular respect. In the COVID pandemic, we have healthcare professionals essentially taking the fall for the government's shortcomings. Doctors and nurses are going to be traumatized. They're going to have PTSD. An entire generation of doctors and nurses and healthcare workers, they're going to have PTSD because they watched unnecessary death, unnecessary suffering, people crying and freaking out. That's not good for your psyche at any job. It's already hard enough to be an emergency room doctor or nurse. And now they're going to have a collective trauma. And it's not their fault that collective trauma exists. It's because of the shortcomings of the society they live in. And when I was working in that call center, I really feel like it's the same thing because it's not me personally who is responsible for the fact that there's no Medicaid expansion or, no universal health care, but I have to be the messenger for someone else's shitty message. And it hurts. It sucks.
Yeah, I can't imagine why that was left up to being a states' rights decision when it was like so integral to the bill.
It's ridiculous. Not only that, but like honestly, the ACA is just a terrible piece of legislation, which is just criminally flawed. Its main issue is that it's not extensive enough. For example, the tax credits that you get are based on zip code, not just income. And so if you live in Texas, you know, your health insurance might cost like $2,000 or $3,000 like less than a person who lives in Maine, or vice versa, just on zip code. And so like if I look up health insurance plans in the state of Kansas, I know they're going to be in the $100 range. But if you look up health insurance plans in, oh gosh, I'm trying to remember a more expensive state. Texas is one of them. Florida is definitely one of them. You know, one of the more expensive states, you're looking at spending like $2,000 or $3,000 a month. And so in one state where your tax credit covers the entire expense, in another state, it doesn't cover any of it. And your health insurance is still just like unbelievably expensive.
Is there even a bad reason why it's like that? Is there a justification, I guess, even if
I have never been given a justification at my work. We were always told that this was how the system is designed, but like the system is shit. The whole application is so janky as fuck. You have no idea. Like the way they designed the online application that people have to fill out at home on the website, as well as the one that we have to fill out with them on the phone, it's just nonsensical. It was designed by a person who has never used a computer. And if you don't believe me, go to Marketplace, go apply, go try to fill out an application. It's absurd. You know, like
I actually did recently. I didn't get very far because they told me they couldn't help me because I was too poor.
Yeah, no, the application is very finicky. You have to know how to fill it out. You have to know how to answer the questions. And in addition to that, from a web design perspective, it was clearly designed by someone who's like in their 50s or 60s. And like, you know, like this person thinks that like the original Neopets website was like a solid design for the Marketplace. You know what I mean? Like it's not a well-designed website at all. And so that does not help. And it's not really designed to deal with a lot of traffic either. And so it crashes all the time. Oh yeah, it crashes all the fucking time. You know what? We have scripts. This is how it works. We have scripts, and so we have to give you scripted information about the question you ask, right? So when the program started, we had, guess how many scripts? 8. We had 8 pieces of information we could tell you, and literally everything else was just guesswork because they had no idea what people were going to call about. The system hadn't been worked out. It was a disaster. And so now we have hundreds of scripts, maybe even a few thousand. I don't know exactly how many, but now we have tons and tons of scripted information, and all of the scripted information. No, you pull it up and you search via keywords. You can give people the information, but the problem is that the information is not helpful enough, and you're not allowed to tell people the truth on the phone. You have to basically speak in like some bullshit code language where you're like, okay, well, you know, I'm not allowed to tell you my opinion, but you could do this, or you could do this, and you have to like emphasize which one you want them to do, because you're not allowed to just tell them, okay, well, this is how this works and this is the best choice for you, because that would be an opinion, which we're not allowed to have opinions.
Well, yeah, I mean, a lot of government services like that run like that. I used to do like retirement services, and we had a bunch of people come to us just for Social Security help because they called a hotline very much like yours and couldn't make heads or tails of it, got bad advice, got weird advice, and just needed someone who wasn't bound, who basically didn't have their hands tied behind their back to explain it to.
We are monitored on all of our calls, and I know for a fact that every single person I worked with, I mean every person I've ever talked to in the ACA and Medicare department, and we both do Medicaid, so that's universal, everybody cheated. And so what they would do is they would keep a person on the phone longer than like 25 minutes because then they wouldn't monitor your call because it was annoying. And so you basically just keep the person on the call for like 30 minutes and then you're free to talk to them as you actually want. And so there have been times when I've been on the phone, you know, the scene in The Incredibles where like the dad is like talking to the lady and he's trying to sell her like an insurance plan, and then he like sneaks away and tells her the truth. It was like that. It was like absolutely like that. I would be like, yeah, blah, 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 blah. And I'd be like, okay, so anyways, I'm past my call limit now and they're not monitoring the call anymore. And I would tell people this. I'd be like, I wasn't allowed to tell you the truth before, but I know they're going to listen to this conversation. Here's what you want to do. You want to go to this place and apply for this thing. because you weren't allowed to tell them the truth. Like if the service functioned as it was intended, I can understand not inserting opinions, but as far as I'm concerned, that's just like lying to people about their options. And I didn't like it. And the deductibles are, oh my God, they're ridiculous. We're talking about like deductibles of like $12,000. It's really bad. The out-of-pocket maximums are really bad, and the premiums on top of that are really bad for plans that like cover nothing most of the time. Like the insurance that I got at that job was as good as any ACA plan, and it covered jack shit. So I mean, if I needed like a surgery or something, I still would have been, you know, like $15,000 in debt or whatever.
Yeah, and a lot of that kind of makes sense logically from the way it was designed. I used to work in insurance, and I came out of it not liking the insurance industry, especially the healthcare insurance industry.
Oh, yeah, no, it's just a fucking like shark scheme. They're all sharks. Every agent I've ever talked to on the phone is a fucking shark. And one of the agents I've talked to on the phone actually called me stupid for telling my person that I was talking to that they qualify for Medicaid. I was like, you qualify for Medicaid, you don't need health insurance. And they called me stupid and chewed me out on the phone.
Yeah. So I was in that when the ACA rolled out, and I remember anybody who sold health insurance at that point thought it was just a dog shit plan. And anytime you asked them about it, they didn't really give you any specifics other than the fact that they set a really low cap on how much you could make selling an individual policy, so they couldn't make money off of it anymore. And just like my inner leftist was like, yes, tell me more. Tell me how you can't profit off of someone else's healthcare anymore.
Oh man, no, I had a couple calls from agents. People would call in just to yell at me, and like I remember this agent, he called in and he was like, "You people ruined my fucking job. Now I can't make any fucking money." And I'm like, I did not get complaints.
Yeah. I mean, that's really how I feel about the whole industry right now. I had someone on Reddit try to argue with me, like, all these people are going to lose their jobs. You can't just make them lose. Fuck if I can, if it saves lives.
Yeah, honestly, I can tell you right now that the job that I worked at that center was emotionally and psychologically damaging to me, and it shouldn't exist. A lot of these jobs shouldn't exist. You know, a lot of jobs are just bullshit jobs. They shouldn't be here. There's no reason for me to sit there and have to tell old women and people who have kids with cancer that they can't get any help. That shouldn't be an occupation. Especially not for $12 an hour. No, that's not good enough. Because we did have a lot of deaths reported and stuff like that. People would call in and report that their kids had died. People would call in and report all kinds of family events because they were required to. And so I got to talk to people about all kinds of fun shit, like their divorces or their spouse was dead or their kid was dead, which was always the worst when someone called in to report the death of their child.
Yeah. Yeah, I've actually had to make a lot of those calls over the last couple of months. They're not fun for anyone involved, and
No. It's horrible. It's hard to listen to people be upset and there's nothing you can do about it. And even if the situation couldn't be resolved in any way, shape, or form, you know, like a person, you know, has died or whatever, it's still very like emotionally laborious, you know. It's a lot of labor. And I don't really feel like it's ever going to be enough money to listen to people say shit like that to you.
Yeah. Like, that's what I was trying to think about when I was thinking about, like, what do you do to make somebody right after this? You have to pay for a lot of therapy, is the only thing that I can think of.
I think that there's two kinds of people who walk into the ACA call center who make it. And that's people who really care but are very good at emotional labor, and people who don't give a shit. Everybody else flunks out. And unfortunately, that kind of job, because of the pressure, the emotional pressure people are under, a lot of people just get filtered out if they care. You learn to turn it off. And it's unfortunate. I don't really feel like anybody should have to learn to turn that part of themselves off, but you have to survive. And then also you just get yelled at by people who are assholes and don't understand what health insurance is. Like, my favorite kinds of calls to take, and by favorite I mean least favorite, were the people who would call in and complain about how evil the ACA was because it was socialism, and how great Medicare was and how they couldn't wait to get on Medicare. It was like so common. It was really good. Like these people would call in and be like, I fucking hate the ACA. That's socialism. I want to go back on Medicaid. And they would always say some shit like that. And it was like too rich because you couldn't tell them that they were wrong, you know?
This is why I think socialism could work. We've gotten people to accept it. We just need to call it something else.
It's so hilarious. Like, oh my God, so many people do not. They call Medicare an entitlement, and we refer to Medicare people as beneficiaries or bennies. We call them bennies, right? And so you're a beneficiary, and this is your entitlement. It's not socialism. It's an entitlement, which is somehow different. But they respond very well to that verbiage. I also had a lot of people.
It kind of is. You're paying into it, right?
Well, I mean, it's a tax thing. You pay into it with taxes. If you do not pay into Medicare with taxes enough throughout the course of your lifetime, then you don't get the same benefits other people do, and you may have to pay. It depends. You have to earn credits to get Medicare based on working. You can look this up on Medicare.gov. I can't fucking remember how many credits it is, but basically, if you're disabled or on dialysis or something like that, they usually make an exception for you. But for certain people, like immigrants who move to the country, there's just no way they're going to work enough to qualify for Medicare because you have to work for like 10 years. I think it is 10 or 15. I can't remember. I think it's 10 years of full-time work. And so many people are not going to meet that requirement because, you know, they were a stay-at-home mom or something like that. And so if they don't have a spouse when Medicare rolls around, they may not get their Medicare benefits. And so it depends on the person's individual circumstances, but there are some people who have to pay per month to get Medicare. A and B, they don't get the free Medicare.
So like based on your understanding of the way that these things work now, the way that Medicare works now, how does Medicare for All expand and solve those problems through expansion?
Well, it would pay for like durable medical equipment, which a lot of durable medical equipment isn't paid for 100%. Medicare pays for things 80-20. 80-20 is how Medicare works. So if it's covered, it covers 80% usually. Some services like preventive services are covered up to 100%, and other services are just not covered at all. And a lot of the procedures that are not covered at all are really fucky and unfair. Like if you look up, like, for example, if someone is trying to have a child, like let's say they're young, but they have a disability which prevents them from working. Let's say it's the condition that I have, endometriosis, which is the leading cause of infertility in people who can get pregnant. They would not cover your fertility treatments because you're on Medicare. And their opinion is if you need to be on Medicare before the age of 65, you can't be, you can't afford to take care of a kid, essentially. There are things like that I think should be covered. I know for a long time abortion has been debated by the ACA and Medicare as well, whether or not it would cover abortion services. But there are other procedures that are just not covered that should be, like, for example, dentures being a big one, eye procedures, ear procedures. Yeah. A lot of stuff that like is necessary for growing older, they don't cover it completely. And a lot of stuff that you need, like for example, if you need like a flat wooden medical bed or something like that, Medicare may not cover that. It depends. They have like a giant ass logbook. It's huge. And you have to be like, all right, what's the item code? And then you pull it up and it'll pull up a fucking script that says Medicare covers this some of the time if it's covered. And they always say some of the time, because if they don't have to cover it, they will find a way to fuck you out of covering it. They will do everything they can. That's why the verbiage is always, Medicare may cover this. Marketplace may cover this, with the exception of certain services, like Marketplace always covers birth control and preventative care, and Medicare covers preventative care. But aside from things like, your yearly visit or whatever, if they don't have to pay for it, they're not going to.
What exactly is covered as preventative care?
Like your vaccines, if you're an older person. Preventative care would be like going to visit the doctor every year, like a wellness check, that kind of stuff. There's a list of preventative services that Medicare covers on Medicare.gov, and there's a list of preventative services that Marketplace covers on Healthcare.gov. But it's mostly like your routine doctor's visits and stuff like that, not dental. So if you go to the dentist, it doesn't count. Nothing for eyes either. I don't know why that counts as like a luxury body part.
It doesn't. Yeah, like if my senses are failing, I would think that would be pretty like important and integral to who I am. but
It's really weird because they are very selective about what they're going to cover, and if you do have coverage for certain things under Medicare, they'll limit you extremely on what you can get. They'll be like, well, we'll cover exactly X number of colostomy bags and no more than that. And that's just the amount that the government has dictated that you need, which is why there are problems with things like hospital days, because you have a 90-day hospital day limit, and that replenishes after 90 days of like being out of the hospital. And so basically it's very, very easy for people who are chronically ill or have some sort of serious chronic condition to run out of hospital days. And if they cannot afford to pay it on their own, then Medicare won't cover it and they may not get health care.
Okay. So it's definitely something that we're seeing a lot more now. It's definitely something that's like in our minds right now with everybody, with just record unemployment. Did you get a lot of calls from people with, like, say, chronic conditions that maybe made it harder for them to keep a job, that lost their job, therefore had a worse time with their chronic condition?
Yeah, there's something for that. There's something for that. It stands for, it's COBRA. It stands for, oh my God. Let me see if I can fucking remember this. Consolidated Omnibus Reconciliation Act, I think. You're gonna have to double check me, but that's COBRA.
That's the one where you can keep paying for your employer health plan that is ridiculously expensive and you're never going to be able to afford
COBRA
it.
is supposed to be the gap plan, but it costs like so much more than your normal insurance. And so there's no way any unemployed person could reasonably afford it unless they were wealthy. But that's supposed to help the stopgap coverage. But we frequently would get calls from people who are unemployed, didn't know what to do. And the answer is, can you qualify for Medicaid? If not, you're screwed. Here's the number to a community health center, which is what I would often have to do. We would have a GPS map and we would type in the person's zip code and it would bring up every community health center, which is basically like a free or poverty-based clinic, like Planned Parenthood kind of stuff. And that's where I go for my health care. Even when I had that insurance, I would normally go to the community health center in town because my insurance didn't cover jack shit. And
not even like the deductibles or copays made it unreasonable. It just straight up wasn't covered.
Well, I could go to doctor's appointments. That was about it. I could go to the gynecologist, and I remember they wanted to do a blood test, and they didn't cover that, and so I was charged like, oh my God, like $1,000, and they didn't tell me I was going to be charged for it. And so the problem is that there are all these hidden fees. They don't tell you how much things are going to cost. They just say, you need this. And I didn't know they didn't cover X, Y, and Z. And, if you call and you're willing to sit on the phone for hours, you may be able to get an idea of whether or not they cover it.
The insurance industry is still there, and they're going to make the money that they think they deserve to make, and they're going to work that into their figures somehow or another. That's why we see copays and deductibles coming up as they're keeping premiums low, because that offsets the cost. I mean, I feel like, especially after having worked in that industry, that really the industry is the problem. If you don't get rid of that, they're going to find a way to screw you for that money.
Yeah. No, healthcare should not be a business. Healthcare should not be a business. Certain things should not be a business. Healthcare is a utility, just like water is a utility, Like every city needs running, clean drinking water. We shouldn't have certain people profit enormously off of like the basic necessities of life. If it doesn't work for a water utility company, why would it work for healthcare?
Yeah. Well, I mean, there's already a principle within insurance that already makes universal healthcare make more sense, and it's group coverage. Because, like, before the ACA, before they got rid of pre-existing conditions, really the only way, if you had what would be considered a pre-existing condition that would keep you from getting coverage, is to join, like, your employer health program and get lumped in with all of these people because it spread out the risk. But, like, obviously, if you lump everyone in the country into the same thing and spread out the risk, why wouldn't that work on the same principles?
The funny thing is about pre-existing conditions is that before the ACA, this is one of the few things the ACA did that I approve of, you could literally be turned down for insurance if you had a diagnosis of ADHD or autism.
Well, that's fucking amazing.
I know because I have a diagnosis of autism. And so I was told, like, I was informed at the age of, like, 8 by a therapist. Like, my mom was there and she was talking to my mom. She's like, well, she's autistic, so it's a pre-existing condition. And once she turns 18, you may have trouble finding insurance. That was like one of the first things we were told. And I remember as a child, we would get letters from the insurance company saying, is your daughter still autistic? Like, that would fucking change. No, I'm better now.
I'm pretty sure they diagnosed like a third of our generation with ADD or ADHD, and
If you had an IEP, it could be used against you because it's a legal document.
an IEP.
An IEP is an individualized education plan for special education programs.
No fucking way.
So IEPs, in theory, are very helpful, but they suffer from all kinds of shortcomings, among them being that the fact that you had an IEP can be used against you in the healthcare industry. Because, again, you have a record of conditions going back to your childhood. So it's almost like healthcare shouldn't be a fucking business.
Yeah, I think that's ultimately what I come to on that as well.
It shouldn't be a business. Taking those calls basically turned me into a fucking communist or some shit. Like, I was so angry. Like, I went from being like someone who was like really milquetoast, and like I was like, yeah, I believe in gay rights, that makes me on the left or whatever. Like, I had no political awareness. And you go in there working for Obama, thinking Obama is this great president, and you deal with this system, this monster that he created that is leaving so many people underinsured, and people have the audacity to go, oh, well, it's better than it was before. Like, I'm sorry, I don't like half measures. I don't like shit half measures. You either do it right or you don't do it at all. And although this is better than nothing is usually a last resort option. Like, I just don't think it's not an excuse. And now that they've taken away the individual mandate, that pretty much de-incentivizes the program, because how the program was built to work was, like all insurance companies, you have to have a lot of healthy people in order to make your money. And so you have to mandate that people buy health insurance. Otherwise, you can't make money, because if the only people who are buying health insurance are sick, it's not profitable. In other words, it's not easy to profit from the healthcare industry unless you're exploiting people.
Yeah, exactly.
You need to exploit people who are healthy in order to profit off of those who are not healthy. It's broken. It's a fucking mess.
The thing that really gets me, like, I don't know, I've been thinking about it a lot over the last couple of weeks. Like, is it actually better? Who benefited from it? I mean, obviously people with pre-existing conditions, but the thing that I keep going back to in my head is, like, that could have been separate. That could have been a separate bill. We didn't need the ACA for that.
I feel like it is truly better than nothing. It's better than what existed before, and I only know that because I've worked in, I know what was before. But better than before is not fucking good enough. It really is the bare minimum. The bar is on the floor, and I really don't think that anybody should be satisfied with the ACA in its current form. I think that we need universal health care, because the entire problem with the ACA is that it's basically an insurance business model, and it's tax credits. And so, like, the government is giving you money to pay insurance companies. So why doesn't the government just provide health care if they're just going to give out literally hundreds of millions of dollars to insurance companies, and it's not even adequately covering everybody?
Because their lobbyists like it better that way.
Yeah.
I mean, there's always going to be an industry coming up with a racket to figure out new ways to get more and more and more government money. That's just something that's going to happen. And when it becomes as necessary as healthcare, they can really put the American people and the government over a barrel to get more and more of that money.
I see no reason why the government should be paying health insurance instead of just cutting out the middleman, because the insurance companies are just a middleman. Cut out the middleman and provide the healthcare yourself, and it would be cheaper anyway. And it would be more comprehensive. But they really don't want to do that because Blue Cross Blue Shield makes a lot of money and they have a lot of lobbying power. Kaiser Permanente, all those companies. I hated those companies. I had to talk to agents and reps with them all the time. And I remember we would get these calls where these people would call in and they'd be like, I can't get my medication covered. And they would be upset, like crying, freaking out. They didn't know what to do. And I'd be like, okay, here's what you're going to do. You're going to put me on the call, and then you're going to do a 3-way call with the insurance company. And because I was there on the line, that's it. I would just have to say, hi, I'm so-and-so with the Affordable Care Act. And then magically, then they could get their service most of the time, which was bullshit.
Well, I'm glad
Because-
you were able
yeah.
to do that. That sounds like it would probably be the most enjoyable part of the job.
It was, because it was so frustrating. They were literally denying people simply because the people didn't know the rules and they didn't bitch enough. And I would have to explain to people, no, they're trying to fuck you. You need to like call them and annoy them, and you need to sit on the phone for an hour and demand that they talk to me, and I'll say 2 words and then magically your medication will be covered.
Well, I'm glad you were at least able to do that. I mean, that sounds like the most satisfying part of the job that you've described so far.
It was
Not that the rest of it set a very high bar, but, you know.
we had some interesting calls because people would call in to report the births of their children, and the other fun part of the job was judging what people named their fucking kids. Like, you have no idea. I'm not allowed to give full pertinent information because HIPAA is a thing, but I will say that a lot of weeaboos called in, and they would all have like anime names for their kid's first name, like names, real first names for children that I have heard: Saiyan, Goku, Vegeta, Bulma, Naruto, Sasuke. Like, I've heard the whole roster. I heard Inuyasha for a little boy. Like, I can't give you last names and stuff, obviously, but legit weeaboos would call in and they would be like, yeah, my baby was born, his name's Inuyasha. And I would have to be like, all right, can you give me Inuyasha's social security number? It was so bad. Oh my god. And then you would have these calls. Like, I think one of the most confusing calls, like I said, the website is not designed to deal with what you could describe as unconventional situations, because basically the website is set up to do, 2 spouses, kids, right? Well, we had this guy call in and he wanted to add his mistress to his health insurance plan. And he couldn't add my mistress to my health insurance plan. I'm paying for my health insurance. And I had to explain to him on the phone that she had to call in and sign up for health insurance on her own. And he's like, well, what do we have to do? And I'd be like, well, you'd have to get married. And he goes, well, I already have a fucking wife. It was really bad. Yeah, no, we had a lot of funny callers, especially at night. Like, really weird people call us at night. I don't know. I feel like people watched infomercials in the middle of the night or got bored and they had nothing else to do and they would call us, because we would just get the strangest calls at night.
How late were y'all open?
24 hours a day.
Oh, wow. Oh, wow. Oh, man. Okay.
7 days a week, except some federal holidays, like 4th of July and Christmas and that kind of thing. But we were there most of the time. Actually, the first call I ever took was on New Year's Day, and it was from a lady in Japan, because we take international calls, and she's an American. She was calling from Japan, celebrating New Year's, and she goes, hold on a second, I'm eating chicken. And I hear her just eating chicken, right, in the background. She goes, this is really fucking good. Does anybody want to get me some more sake? And I hear her pouring sake, like, and she's like, I'm sorry, I'm in Japan for New Year's. Can I talk to you about my health insurance? And she's like drunk, And these are the calls we would get at night. Like, people would call in drunk and they would be like, what's a deductible? And you would have to explain to like a person clearly intoxicated what like a premium was. So we had a lot of weird calls. I don't know. The people called in and pretended to be Shaggy and Scooby. Like, that was fucking spot on. People just love to prank the ACA line. I think that people called in and pretended to be the Ninja Turtles and tried to order a pizza was one of the funnier ones. But that wasn't me who technically got that call. I was only listening in. It was a person I was training who got that call. And then I had to be like, you need to hang up now. And they were like, am I allowed to do that? And I'm like, click, But yeah, no, we had a lot of really weird experiences. And so I would say the calls were divided pretty evenly between angry people, tragic stories, and like people who were just so frustratingly ridiculous that you didn't even have like words to articulate whatever the fuck just happened. And that was generally, and prank calls. But prank calls were the smallest slice of the pie, unless you worked nights. In which case they were all of your calls almost.
Yeah, I can imagine.
Yeah,
I never would have thought to like get drunk and call the ACA but I guess you're probably one of the few like 24-hour call lines like that you could really prank call. So
Medicare, people love to get intoxicated and call Medicare in the middle of the night. Old people get fucked up on opiates and they become addicted to opiates and they call Medicare in the middle of the night when they can't get their opiates. And they'd be like, I couldn't get my pills today. And they're like clearly addicted and going through withdrawals. And they like scream at you because they can't get high on Vicodin. Yeah. You know, it's nuts. I had an old lady go, you don't understand. I need Oxy. And I'm like, okay. I don't have any control over whether or not your prescription gets filled. And we had a script that was like, the government is trying to reduce opioid addiction, and here's what we're doing. And I was like, you want me to tell you what the government is doing with the opiate stuff? And she's like, they already read that to me. You know.
Maybe the fact that everyone who gets you on the phone wants to read that to you should be a little bit of a wake-up call.
I had so many ridiculous calls. I had a call, this lady called in, right? This is a real fucking phone call that I had, and I could not believe this shit. It was an old lady, and she called in, and I was like, okay, I'm required for legal purposes to ask, is anybody on the phone right now? Because of HIPAA, I need to have authorization if they're on the call. And she's like, yeah, there's someone listening on the call. And I go, okay, what's their name? And we go through the whole thing, right? The whole authorization process, right? And I'm like, and what's this person's relationship to you? And I shit you not, she goes, he's my cat.
Oh my god, that must so infuriating.
Yeah, no, people are like that though. And then one of my friends got a call from someone asking if we were allowed to add dogs onto ACA insurance policies, and we had to explain to them, and now we have an official script for this saying we do not carry pet insurance. Someone wanted to add their dog to their plan.
If there's anybody out there in my small listening audience that can get their hands on that script, oh my god, I want to see that now.
Yeah, no, like people are ridiculous. So I mean, I had some fun calls, but ultimately I think the crisis calls were just way too much for me. Anybody who has like a soul, it's going to be really hard for you to listen to these people and what they're going through, especially if they have a kid. Those were the worst calls. Like people would call in and they would say, I don't know what to do. I have a kid, I can't afford this medication. And then you'd be like, well, can you move to a different state? You'd have to tell them the truth. You need to go to a community health center. If you don't qualify for Medicaid, you need to go to a different state. In most states, they cover children completely, but some people who live in territories outside of the 48, like Puerto Rico and Guam, cannot get access to the same services that other people have access to. And so if you're Puerto Rican, although you can sign up for the marketplace, you don't have the same benefits because you're not really like a U.S. citizen. Although to be fair, Native American people, indigenous people got way better benefits under the ACA than most people because of, I can't remember what law it was, but basically almost everything was covered if you were indigenous and part of a federally recognized tribe.
It's a little late, but better late than never.
Yeah, no, it was good. And people would call in and they would say, I want to go with the ACA plan because the options on my reservation or the Indian Health Services options are shit compared to the ACA. And indigenous people had all kinds of abilities to change their plans and stuff like that other people didn't have. Normally, if you were in a plan, you couldn't change it like every month. But if you were indigenous and you had the paperwork, you could change your plan every single month. You could just choose a new plan. And I did not understand why we didn't just expand those kinds of benefits to everybody, but I wasn't in charge of the program.
Well, I guess you will be when you run for president. You laugh, you don't take that seriously, but this bar keeps getting lower, like any of us could run.
Yeah, I know.
What experience do you need? What good character? It doesn't matter. Anybody, just sign your name.
Yeah, no, and it's scary now because, like I said, my roommate quit because of the COVID pandemic, and then I have another friend who's working there right now in the Advanced Revolution Center, which is ARC, right? And that's where they send the high-profile shit, and they're not practicing social distancing. They give everybody one hand sanitizer wipe to wipe down their desk with, and that's it. And we desk share, so that's absurd. No masks, and we're declared essential staff. So quite a few people quit.
Look, I don't understand why they're doing anything that they're doing as it relates to COVID. Like, the just desk sharing during this, that's so far the opposite of social distancing.
And they could really significantly cut back on a number of different things. They could make it to where people were not only separate, but you basically have like a skeleton crew of only who we actually needed. They could do a lot of things. And I understand people don't want to get laid off, but I bet they don't want to die even more.
Yeah, I would imagine so.
It bothers me because when I was working there, you know, we have a lot of elderly people who work there, and they work for the Medicare line. And the reason why they work there is because, you know, they want something to do in their retirement, or they want something to supplement their retirement income. And so we have like a fuck ton of part-time old people who are Medicare, and they're just going to get annihilated if they get it, you know? And I mean, call centers are basically just, you know, Petri dishes. Anyway, it's like a school, you know, filled with children. It's just like basically a recipe for like any type of infection. So anything that swept through that place, everybody got it. Which is why when the outbreak happened, I sat there and I begged my roommate, like, please don't go to work. This is not worth dying over. And he quit.
For example, can you think of an example of like a flu or something like that did exactly what you're describing? I mean, obviously COVID's going to be worse.
No, every single time a flu, any type of illness spread through that building, within a week, everyone had it. Everyone that was going to get it was going to get it. And it was in both buildings, because of course it was in both buildings, because people walk in between buildings all fucking day. You work in one building, but the other building has things that you can go get. Like you can go buy food, or you can go get coffee, and that's in both buildings. They have different food options. And then you can go visit your friends in the other building. And if you're a supervisor or manager, or if you're having a meeting, you may be required to go to the other building. And so it's just nonsense. And of course, you have to touch all the fucking door handles. The buildings are literally like 20 feet apart, and they are heavily, you know, trafficked by both people, especially since only one building has a crushed ice machine, and everybody, this is just human nature. Everybody goes to that building to get crushed ice on their break. And so it's like a traffic flow of people standing there getting fucking crushed ice. And it's like, look, crushed ice is not worth getting COVID over. And then, of course, people would come from local restaurants, and they would sell food on different days of the week for people to buy at lunch. And so, you know, in building A, you would have these people from local restaurant B, and in building 2, you would have like these people from restaurant, you know, X or whatever. And so if you wanted the opposite restaurant, you had to go to the other building. And so they're not really designing it in a way where it's easy to social distance at all. Especially since we work in closely knit cubicles, and there's like 8,000 people on our site alone.
I mean, yes, it doesn't sound like it would be good for social distancing, but you would think that they could, you know, temporarily change the way that they do it.
Yeah, you would figure that they could reduce their staff. 8,000 people in a single area sounds like a fucking disaster. Or you could have people work from home, but they insist that there's no way you can work from home because of the secure floor policy, which is bullshit. You're not allowed to have paper on the floor because, you know, you work with people's social security numbers and stuff. I get it. You work with people's health information. Oh, we're not allowed to have our phones on the floor because some fucking lady ruined it for all of us by taking a picture of herself in front of her desk with a person's information visible and posting it on Facebook. And so that's why we can't have phones anymore. Yeah. So they say that because of the secure floor policy, we can't work from home. But what about a program like Citrix, which prevents you from copying information which is on your work laptop or creating a screen cap? You know, you could potentially set it up like that, where you could have people have some sort of special work laptop where they cannot copy the information at all. I mean,
would that really stop you from like writing it down at your desk?
No, but people are already doing that. And the reality is the secure floor policy is really easy to get around. Anybody who's worked there knows that everyone checks their phones even though you're not supposed to have them, and people doodle even though you're not supposed to. And we had a guy come in, and he got in trouble for being on his phone, and you're supposed to immediately get fired if you're on your phone. And the supervisor was like, I don't want to have to fill out the paperwork to fire you. You just put your phone away. And that was the extent of the trouble he got into. And so, like, I doubt that the secure floor policy works now. I think that people who are going to try to steal people's socials are going to try to steal people's socials. I mean, that doesn't mean we shouldn't take it seriously, but I just doubt that there's absolutely no way we could work from home. Or you could only have like general answers. You could have a general questions line, and those people could work from home. And people who have to have access to pertinent information could be there as the skeleton crew. You could do something. but instead they're choosing to do nothing.
Yeah, that actually does make a lot of sense when you bring it up that way. You know, if you ever get into a situation where you need to take that information, you could just transfer them into one of those buildings with your skeleton crew and have them take care of it.
Yeah, especially since we have sites all over the country. We have one in Arizona, one in Florida, one in Kentucky. We got a whole bunch of places all over. They're all over the country, and so we have multiple. We've got several in Texas. They're all over the country, and each site has like 10,000 employees.
Wow. And these are all through like, I mean, I understand you're working through like the same program in the government, but are these all through the same company, or is it like a tree of companies, or how does that structure work?
It's a contract that gets basically bounced around. And so for a while, General Dynamics Information Technology, which loves to make bombs and that kind of thing, they were the one that held on to the health contract. Then they sold it to Maximus Federal. And it's been that way for forever. I think Vangent was one of the people who owned us for a while. Basically, the contract every X number of years just gets passed to a new bullshit corporation and the rules change. When I worked there, my stint was during General Dynamics' reign of terror. And I worked there for a little bit when Maximus was there, and Maximus didn't really seem any different than GDIT. They had like a stricter attendance policy, but that was about it.
But none of those other problems that we've talked about for a while now were fixed. Just the whole attendance.
No, the attendance policy originally was so lenient that it was almost a joke. Like, you could miss like 40 hours and then they would give you a write-up that said, please don't do this again. And then you could miss 40 more hours and they would give you a real write-up that said, hey, if you do this again in the next 12-week rolling period, we'll fire you. And then if you did it again, then they would fire you. So it used to be very generous. And people get fired. They would get fired because nobody wanted to be there. Because literally everybody just wanted to go home. Because it was so stressful to be on the phone and take these calls. I remember it was completely normal, regular, 100% everyday occurrence to see people cry in the break room. That was just a part of the job. We were told when we signed up, you know, if you see someone crying, you know, they probably just had a bad call, and that's okay. It happens. And then we had a crisis call procedure, and we had all these other procedures that we went over to, you know, how to deal with like the emotional stress. And it was not adequate, to put it politely. Yeah, we were told that we needed to just be polite and reassuring to people, and that's not enough. It does not cut it. Oh, and wave a red flag if they say they're going to kill themselves or another person, but only if it's a specific threat. We had a list, okay? Like if someone said, I'm going to get my gun and shoot someone, then you could raise your crisis flag. But if they said, I'm so mad I could kill someone, because it's not a specific threat, you couldn't raise your crisis flag.
Yeah, because they haven't told you in detail how they're going to do it.
They wanted to make sure that the individuals were serious about the threats, but because of this policy, sometimes people who were very clearly suicidal, but were not saying the magic words to be taken seriously, would not get the priority that they needed. And like I said, it was not unheard of to have people kill themselves on the phone with the callers, you know, the call representatives. We were called CSRs, or customer service reps. Yeah, it was a nightmare. It was a fucking nightmare.
When you say not uncommon, I figured it would be pretty uncommon. Even though you've already described one incidence of it happening, how often would that happen?
I would hear about it happening to someone probably every week, but how often would you get a crisis call personally? That just depends on your luck. I think the month that I quit, I got like 3 that day. Like, I was having a very bad day, and it was like one after another of a person saying, like, the first one was like a person's kid was dying and there was nothing they could do. And they were like, I don't know what I'm going to do. I don't have anybody except my child. No one loves me. Like, all this shit, you know, it was way heavy. And you can't really do anything about that. They're just screaming into the ether, you know, because they're in pain. And that shit just eats at you. You can't deal with it. There's only so many shitty calls you can take before you're like, I can't fucking deal with this. And then you leave. And that would happen a lot. We had a really, really high turnover rate. Like, they cannot keep employees in the ACA call center line. I was one of the, like, long-term employees because I had been there for 2.5 years. And that's not to say there aren't people who've been there for 10 or 15 years. There are, but those people are like 1 in a million, in my opinion. You know, most people who make it through that training class, they do not last because they don't want to listen to those kinds of calls.
Yeah. How did you make it for 2.5 years? What?
I needed money.
You okay?
I needed money, and like basically, I just had the grin and bear it philosophy.
Mm-hmm.
I missed a lot of work. I would get ATO or approved time off because they were always offering it for times when we weren't busy.
Yeah.
And so I would just go home early a lot, and that starts coming, cutting into your paycheck and stuff. But
Yeah.
you do that. Everybody does it. Everybody's like, I'm not going to take ATO. And then you take ATO, and then next thing you know, you work 25 hours that week because you can't be there emotionally.
Yeah. But
So
that sounds pretty necessary given what you were going through. Like,
it's not good for your paycheck, though.
well, yeah, that's true, but it's not good for your mental health if you prioritize your paycheck over that.
No, it's not. It's hard because a lot of people have to eat and they don't really have a choice. But I remember one of the managers, she kind of frustrated me because she was one of those people who really buys into the whole, meritocracy, pull yourself up by your bootstraps shit. She's also very religious, and so that was not, she and I were just not compatible people. But she was bragging to me and to all the other people on the floor, like, I make $16 an hour. And it's like, ooh, big fucking whoop to deal with this bullshit. Like, I cannot even believe that you would think that's worth bragging about. Like, I take these calls. I know how much fucking money you make. And at that point in time, I made $15.45 an hour. So I made almost as much as her because I got promoted. I was a tier 2. Ooh, that meant I dealt with people who were mad about their tax forms because the healthcare is inherently tied to your taxes, which, by the way, the ACA can totally fuck you if you don't qualify properly for the tax credit. So let's say you did not know how much money you were making because you're an independent contractor or you're self-employed. And so you guess, and you guessed wrong, and you qualified for the wrong tax credit. Well, you have to pay it back. You have to pay it back. And sometimes people would call us and they would be screaming and crying. They wouldn't know what to do because they would have to pay like $25,000 in tax credits back.
In 1 year?
Yes. Yes. Because they didn't qualify for the credit. Because they didn't actually qualify for the credit. Yeah. No, and they would only find out after it had happened. It's just completely ridiculous. Like, the number of people would call in and they would say, well, they're saying that I owe $10,000 because I didn't qualify for all of my tax credit, but I sell houses and I don't really know as a realtor how I'm supposed to give you an accurate estimate of my income. And I would just have to say, yep, that's how the system is designed.
Yeah, that's fucking garbage.
Oh, it's totally garbage. You can get penalized really, really bad if you guess your income wrong. And it's not fair to people who are self-employed or they're contract laborers, like construction workers or whatever. If you don't have a set idea of how much money you're going to make in a year because you don't have an hourly or a salaried income, the ACA is probably not for you.
And that's a lot of America's work. That's like half of America's workforce right now.
Yeah, no, it's definitely woefully inadequate because many people don't qualify properly for the credit and they are expected to pay it back. And we tell them that, but nobody ever listens to us when we read the disclaimer language because it's like 5.5 minutes of us being like, so anyways, like, and it's bad. Nobody wants, they just tune it out. They just hear Charlie Brown adult people talking noises, like the wah, wah, wah. Because they can't deal with it. And honestly, I can't blame them because, signing someone up for Medicare or the ACA, that's like a fucking hour-long call. It's exhausting. It's exhausting for the person taking the call and for the person on the other, end of the line because nobody wants to be on the phone with a call center rep for an hour.
Yeah, it's true. Just curious, but in that $25,000 scenario, how much of that is actually like a penalty? And how much of that is just what the government covered that they decided that they would? Because the thing that I'm having a hard time imagining is an insurance policy that would be worth $25,000 a year. That just seems ridiculous.
What if it's $2,000 a month or $2,500 a month or $3,000 a month? Or it's a family plan for $4,000 a month. Those are very common prices for insurance plans. And if you didn't legitimately qualify for the tax credit, you have to pay back the portion you didn't qualify for. So it's not a penalty. The penalty is you must pay back what you didn't qualify for. Problem is, what if you didn't qualify for your entire credit? Which a lot of people don't. So you thought you were covered. You thought you didn't have to pay for this, and now you realize you do have to pay for it. You couldn't afford it. No, it financially influences people. It doesn't count. It doesn't count, and also the language is intentionally sort of like obtuse and difficult to understand, and people always ask what it means because it's worded in such a way that like no average human being would really understand it. And so I think that's part of it too. You have to read it, like the disclosure language, you have to read it carefully. And that's another problem with health insurance as a business, you know, the idea that you would have all this disclaimer language and all these hidden, you know, penalties or fees, or that it may totally fuck you over tax time and that you may not even be aware of that.
Well, that's kind of insurance in general. Like, even being in, like, primarily selling life insurance, there were so many people that had been working in the industry for 5, 10, 20 years who still were like shocked and amazed when they actually sat and read through an insurance policy and were just finding weird shit that they had sold. They had sold this a decade ago, and they didn't realize that some of this stuff was in there just because of how obtuse it was, or they just didn't realize it until their client had that problem, and then they looked at the policy and said, yeah, here's why you're screwed. I don't know why I didn't notice that when I sold it to you, but what am I gonna do about it?
Yeah, no, and plans would frequently change what they covered without telling people.
Really?
That was another. Oh yeah, no, that's a big problem.
Annually or more frequently than that?
Sometimes more frequently than annually, but at least annually.
Jesus.
Like
I can like that.
Annually, the plans change.
At the same time, more than annually sounds like.
It depends. It depends whether we're talking ACA or Medicare. If it's Medicare, they can change shit around and they don't have to notify you, and it's your job to be basically doing your due diligence. If it's the ACA, usually it's on a year-based contract, usually. However, you have a limited time frame to sign up for these plans. And if you realize you signed up for the wrong plan, you're pretty much fucked if you're past that window. And so you may be stuck with insurance which doesn't cover what you need for an entire year. Because like you can't freely
you can't get out of it? Like, I realize you wouldn't be able to change to something else. You can't cancel it?
You can cancel it, but you cannot buy a new plan through the ACA until open enrollment happens unless you have a special enrollment period. So a special enrollment period would be like a life event that triggered an employment change. Hi, what's up? Do you want to come talk shit on the ACA?
You're welcome. The more the merrier.
Come tell some of your bad stories. Yeah, no, you got a lot, so, I mean, you might as well. I know, they all mold into like one singular fucking experience.
They all sound the same. Everyone sounds the same.
Okay, come over here and back me up on this.
On what?
You come here and I'll ask you about it because I want verifiable proof that this was a thing that occurred.
A thing. What was the thing?
Okay, we have time for about one more thing, so make this a good thing, Evie.
What are we talking about?
Did weeaboos call in and try to name their children after Dragon Ball Z characters? Yeah, it did. Yeah, okay. We've got time for one more thing. What do you want to say about the ACA? Do you have a bad story you want to share?
Or a funny story? Anything's good.
Funny story. I don't know.
You can say why you quit because they're not protecting you from COVID.
Well, I mean, I did try. I did request their, what do they even call it, FMLA or something like that. They were asking for proof that either I had a positive test or that I was ordered to quarantine by a doctor. I don't think I'm going to get anything like that. So
nobody's getting tested. Yeah, no, that's why the policy is bullshit, and they'll only give you X number of days off, and you know it's really bullshitty. A lot of people have complained about it. Do you have questions for Tim about the ACA and his experience?
No, I think I got plenty from you, unless there's anything that you want to say.
I mean, is there anything you didn't touch on?
Well, I did mention.
What's most important to you? Like, what was the thing that keeps you up at night about it? I guess.
I guess really is just the inability to actually help anybody that is low income. Definitely is the most probably one of the worst things, at least the most common worst thing that you'll experience working for the ACA. Yeah, probably that for the most part. Families that don't earn enough income, especially families, you're probably more likely to get it if you're a single person earning, just your own income. But if you're like a single mother with like 3 kids that you have to take care of, and you're just going off of like one job's income, the likelihood that you're going to get a tax credit to help pay for your coverage is probably not likely unless you have a really good job. Yeah. If you earn $20,000 for a family of 5, probably not getting a tax credit, especially if you live in a conservative state. So yeah.
And with us conservative states, I happen to live in one of the 14 that doesn't have the Medicare expansion, and I am right in that part where I get to be too poor to get any subsidy whatsoever, and don't get any Medicare to cover it either. So I'm just fucked.
Yeah. It's
Meanwhile, all the prices have gone up, so if I try to get something outside of the system, it's going to be ridiculously expensive. And yeah, I'm just fucked in every direction.
It sounds about right. You're in the boat with a lot of folks then, honestly. Yeah, it's a shame, honestly.
Do you want to say why you quit?
Oh, well, I just didn't go back, technically. I don't even know if they fired.
Yeah, that's right. They haven't fired him. He just keeps not showing up, and they keep sending him an email like, we'll fire you. You keep not showing up.
Does he keep getting those, like, 40-hour every week? Like,
well, no, they've changed the attendance policy. They've changed it. Now you can only miss, 64 hours in a year?
Yeah, it's 64
But it's
hours
weird because they don't approve
year
certain types of
period.
absences. Like, I missed basically the required amount just because I had the flu for like 2 weeks. And they were like, sorry, we don't cover the flu. It's not an excuse to absence.
Well, that sounds incredibly healthy.
Yeah, no, you can't just bring in a doctor's note. You cannot do that. They will not accept a doctor's note.
Yep, that's how I got fired from my last job, actually. I brought in a note from the ER, and during that period of time, I got fired. It's fun stuff.
Yeah.
But my camera has now officially died, so I'm just audio only at the moment. But it was good chatting with y'all. Thank you.
Yeah.
Thank you for sharing your experiences. I hope they kind of help open some people's eyes about not only just the ACA in general, but the kind of call center conditions that you guys were working in, even when we didn't have a pandemic.
I'm Jackie Fox, and my content will always be ad-free because I'm eschewing corporate donations to the channel. I just ask that if you can donate a little bit of money on Patreon like these fine, foxy folks, or if you want to make a one-time donation, you can donate on Coffee. If you're looking for another way to support the channel, I'm also making Fox hats with my logo on them. They are currently in the design phase, and I'm willing to allow people to ask for customized hats. Prices may vary depending on the cost of labor to manufacture them, because I want to make sure that my workers are paid fairly. But I am happy to say that the next few months, if you're a patron who has donated to this channel, I will be counting all of your donations against the cost of your first Fox hat, allowing you to get it at a discount.